Got it. Well, I'll get things started today, and we're hoping more people will be joining us today, but otherwise, welcome to those that joined us now. I just wanted to let everybody know that we are recording this session today so that we can put it up on our SCIBC YouTube channel for later. So if you don't want to have your face seen, you can stop your cameras. We're going to ask people if they could just mute their microphones so we don't get some feedback. And then when we ask questions, you can either add your questions to the chat, or you can, at the bottom of your screen, just go down to reactions and raise your hand if you'd like to ask a question throughout the presentation. But again, welcome everybody online as well. Who's here watching this. My name is Scott Heron. I'm the peer support specialist for spinal cord injury BC in Victoria, South Vancouver Island. And one of the things that has come up last year as a result of the heat dome that BC experienced was an issue that was affecting a lot of different people, and the conversations came up during our conversations online, and we talked about it quite a bit, and we decided we should provide an Ask an Expert session on the issue of skin and wound care. And today we have with us Jessica Lee. She's registered nurse and a wound ostomy continence nurse. She previously worked in both the acute and community setting as a WOCN. You'll have to let us know what that means, Jessica. She currently works as a territory manager for Coloplast Skin and Wound Care. So welcome, Jessica. Again, if anyone has any questions, please put them in the chat or raise your hand so we can get to them. And Jessica, if you could introduce Pat for us as well.
Yeah, thanks so much, Scott. Thanks for hosting this session, you guys. So today we have Pat Dahlbeck speaking for us. Pat is a graduate from the University of Alberta, and she graduated in 1977. She obtained her BSN in 1992, and she completed her Enterostomal Therapy Program in 2009. She's also a Nurse Continence Advisor, and she completed that certification in 2012. Pat has over 40 years of experience in acute and community and is incredibly knowledgeable, just all things wound ostomy continence. So super excited that she's going to present for us. Thanks so much, Pat.
Thank you very much, Jessica. So welcome to Interdry, a proven approach for real relief. Before we get started, I have to make a disclosure that I'm not representing Alberta Health Services in this presentation, but that I've been asked by Coloplast to speak. So today we will discuss Intertrigo, the causes and traditional treatments, and why Interdry was named by Wounds Canada consensus paper in 2013 as best practice for prevention and management of Intertrigo. So what is Intertrigo? Intertrigo is a short word for the diagnosis of intertriginous dermatitis, but it can also be seen in its abbreviated form of ITD. It's a form of moisture-associated skin damage resulting from prolonged exposure to perspiration within skin-to-skin contact areas and beneath devices. And some of those devices may be splints, braces, different types of tubing as well. Intertrigo comes from the Latin word inter, which means between, and ter, to rub, which is skin on skin. Some of the common characteristics of Intertrigo is that it often appears as a red rash. It's located in folds of skin where air circulation is limited. It can be patchy and widespread in and around the skin folds. The overhydration of the top layer of skin causes maceration, or that white breakdown of skin. And early symptoms often are complaints of itching, burning, pain, that sour odor, and redness or erythema. And sometimes we even have the loss of your epidermis, or the top layer of your skin. So what happens if intertrigo is not treated? If early symptoms such as itching, burning, pain, and that sour odor and redness are not detected, it can lead to a more serious condition, such as a secondary bacterial or fungal infection. So if a skin fold damage develops, you'll be facing not only a more serious condition, but also longer and more complicated treatment time. And unfortunately, people will experience more pain. In this picture, you'll see a woman suffering from intertrigo, which is located above the left groin near the abdominal fold. This condition has been around for 4 days and has been triggered by 3 small draining wounds that have not been properly treated. And you can also see evidence of a candida or yeast infection. If you look, you see the red area in the skin folds, and then surrounding that red area are those red patchy satellite lesions. And those lesions are characteristic of yeast. She also complained of itching and burning. So what causes intertrigo? So moisture gets trapped within the skin folds and beneath the devices where air circulation is limited. Overhydration of the top layer of skin does not glide on opposing skin surfaces, leading to friction damage. That wet, macerated, or white skin becomes inflamed and broken down, providing a breeding ground for bacteria, and then fungus may develop on that wet skin. Often Candida albicans, or yeast, is the organism that we like to treat, but there are many bacterial species, including staph, strep, gram-negative species, and antibiotic-resistant strains that also need to be addressed. So some of the traditional treatments for intertrigo or intertrigo are antifungal creams and powders, and often this is our first choice, especially for physicians. Gauze has been used, paper towels, linens, pillowcases, washcloths and towels, talc or cornstarch-based powders. Traditional treatment options have questionable benefits and may even make the condition worse, since they don't address all 4 causative factors. And those 4 causative factors, again, are moisture, friction, bacteria, and fungus. So our antifungal powders and creams only target fungus. The challenges often with traditional treatments is failing to address all 4 factors at the same time. Antifungal creams, they only address fungi, but by making the skin moist, they could also be promoting skin damage. Often those powders or the creams trap the moisture within those skin folds, and they fail to remove that moisture and reduce that friction. And they also lack the ability to protect against bacteria. Powders, whether it be baby powder, antifungals, or cornstarch, are often the first line of treatment. However, when we mix powder with sweat, the result may resemble like a ball of dough, and it does not reduce that friction, and in fact may cause it to be worse. And cornstarch has no proven benefit and actually may encourage fungal growth, as cornstarch is a substrate for the growth of yeasts. Another treatment, a traditional treatment for intertrigo, is linens and gauze, and these only target friction. Often they fail to translocate or remove that moisture effectively, and they lack the ability to protect against fungus and bacteria. Now, the moisture, gauze, linens, and paper towels are often placed between the skin folds and usually are ineffective as they absorb moisture but do not allow it to evaporate, promoting skin damage as that wet fabric stays against the skin surface. Gauze is often coarse to touch, and when wet, it bunches and rolls, leading to increased damage from friction and pressure. The coarseness of the gauze is often described as scratchy and does not reduce friction. However, it does keep skin off skin. So Interdry is different. It manages the moisture. So it's crucial that the difference between wicking and absorbing is made clear. If the skin fold management, you want the skin to be clean and dry, as a moist environment can be detrimental to the healing and may promote further damage. Interdry wicks and translocates the moisture away from that affected area. Interdry manages the friction. It reduces friction with its polyurethane coating. If you feel it, you'll find that it's very soft, and you can see how it would reduce the friction between skin folds. It also keeps the skin folds from touching each other. So again, it reduces that friction between the two. It manages both bacteria and fungi. Interdry draws the moisture and kills bacteria that is drawn within the moisture. It provides a broad spectrum of sustained antimicrobial activity, not only against fungi, but also a broad range of bacteria and skin fold infections. And in skin folds, bacteria is just as important factor to address as fungi, and therefore antifungal creams limitation, as it only attacks the fungi. So what makes Interdry a little unique is that it's the only product of its kind with the ability to disrupt that vicious and everlasting cycle all at once. It wicks at the same time, it reduces friction. At the same time, it fights those microorganisms. So that's why they call Interdry fourfold technology. So it's proven to provide a complete symptom relief within 5 days for as little as $5 by targeting all 4 causes of intertrigo. So it targets the moisture by translocating it away. It manages the friction between the 2 skin folds. It manages both bacteria and fungus as well. So Interdry has proven to resolve or significantly improve symptoms within 5 days. Now, this is a study that was done by Carolyn Kennedy Evans et al., where she performed a clinical study to determine the efficiency of moisture wicking textile within silver instead of the standard therapy in patients with intertrigo. They had 21 patients with the intertrigo in a couple of long-term care centers. So a skin assessment was done on day 1, day 3, and day 5 for itching, burning, maceration or wetness, the broken down skin, some satellite lesions, the redness, and odor. So in this study, moisture wicking textile with silver, which is your Interdry, relieved the patient's symptoms and signs of intertrigo within a 5-day period. So she found that resolution in the itching and burning and maceration was 100%, 65% resolution of the redness, 72% resolution of the denudement or broken down skin, 80% resolution of satellite lesions, and 65% resolution of odor. So that moisture wicking textile with silver is also cost effective as it reduced the nursing time substantially. And what I should say is that with Interdry, it's the silver that targets the bacteria and the fungus. So it's effective for both. Again, the study was shown to improve patient satisfaction. 80% of patients reported overall satisfaction, and we rated it as very satisfied or quite satisfied. 70% compared it as much better to the current product that they're using. and 94% stated that they would recommend Interdry for further use. And that what this study also found is that there was a reduction in cost and treatment time as compared to the antifungal treatment protocols. So persistent intertrigo cases can take a long time to resolve since that ongoing cycle of the factors keep feeding on one another. Since Interdry addresses all 4 factors at once, you can see that the same case study that has been persistent for a long time resolved in just 5 days. So think about all the nursing time and product costs saved, and most importantly, the impact on the people's condition to be resolved in just the 5 days. The first, I'll only address one. There's 2 case studies here from patients that suffered from intertrigo over a long period of time, but I'm just going to address the first one to the left. So this is a 46-year-old female who was receiving rehab for obesity, and she also had some osteoarthritis, so her mobility was impaired. She was type 2 diabetic and had some hypothyroid issues. So they did a skin assessment and found that she had a fungus infection located in the right posterior thigh, and it had been present for 98 days. Her current skincare protocol included daily cleansing with bedside care foam, followed by an application of antimicrobial cream mixed with equal parts of antifungal cortisone cream daily and an antifungal powder as needed. So as you can see by the length of time and the severity of this infection, it has not been effective. Using Interdry reduced the length of treatment from 93 days to 5 days total, and reduced the cost of treatment from $326 to $7.63.
Pat,
Yeah,
can I break in with a question that's come in from the chat?
absolutely.
The Interdry, is it washable?
No, if you wash it, you remove the silver. And so the silver is your antimicrobial component of this product. So it's not recommended.
Okay, thank you.
I know it's done, and it's done, it'll still manage the moisture, but you won't get the benefit of the silver.
Right. Thank you.
Yeah, good question though. Comes up all the time. So again, this study compared Interdry to the traditional treatments. What it found is that Interdry was the only product that managed all of the symptoms of the intertrigo over those 5 days. It proved to reduce the treatment time and costs, the high report of patient satisfaction. It simplified protocols and reduced our management time. So even when we use the antimicrobial treated gauze, what we found with that is that you have to, it absorbs the moisture, but it doesn't translocate it out. So what it does is it actually causes the gauze to kind of maybe expand, it shrinks on itself or it rolls. They complain that it's itchy. And so you have to change it more often. So oftentimes you're changing it every shift. So that change increases our nursing time as well as it increases the cost of the product. They did find though that that the linens also reduce the skin to skin friction. But however, the other products didn't transport that moisture away from the skin. The nystatin powders and creams managed against fungal contamination, however, did not manage against bacteria. And so Interdry was the only product that managed the both the fungal as well as the bacterial contamination. So now Interdry has an all new appearance. I'm not sure if previous people have used it before. It used to be white and the measuring markings just said Interdry, Interdry, Interdry. So because what happened is Coloplast looked at that feedback and said, I'm going to change this product to enhance how we use it. So they changed the color from white to gray because the complaint was that the white product would stain kind of yellow, like, you know, our t-shirts are under our armpits and our t-shirts, that yellow gray. And so they would think it was contaminated and discard it prematurely. So even though it was white or it was stained yellow, it was still effective over those 5 days. So they changed the color to minimize that unsightly discoloration from the perspiration, to reduce that premature fabric disposal. And they also found, because it was gray, not white, it was less likely to get lost in the person's bed linens. They also changed the grid pattern and wrote on it that it was good for up to 5 days, again, to prevent people from prematurely disposing it. So it helped ensure optimal product performance. And also the grid will be so that you can leave the 2 inches of exposed fabric to allow for that translocation or the movement of that moisture. And I'll explain next how to actually measure and use this product. And they found that that 2x2 grid pattern, which ensured those 2 exposed inches, improved sight lines for cutting as well. All right, I'm going to just go down here. Okay, so really, how do we use Interdry? So first, I'm going to want to wash the skin gently. New studies on skin hygiene have just come out, and they recommend using a non-rinse skin cleanser that has a surfactant in it. That surfactant will help remove any of the debris and bacteria off the skin surface. An example of that would be Coloplast C-Cleanse. So you gently wash the skin, and we pat dry, we don't rub. Rubbing is going to increase the friction and skin damage as well. So with clean scissors, we're going to cut enough fabric to cover the affected area, allowing for a minimum of 2 inches to extend beyond the skin fold for that moisture evaporation. So that's going to be 2 extra grids. Gently smooth, and then we're going to lay a single layer of fabric in the skin fold, placing one edge to the base of the fold. Gently smooth the rest of the fabric over the skin, keeping it flat. Again, leave those 2 inches of fabric exposed on the outside of the skin fold. The markings on the Interdry roll will help you measure that. So we measure the area that's needed and then cut 1 or 2 of the extra markings. This will give you your 2 inches of exposed fabric. Once you've measured and cut your width, cut it again lengthwise. You don't need the full width to be effective, as skin folds shouldn't be that deep. And then you can put that extra piece of fabric in a labeled bag for your next use. And that saves you measuring and cutting time as well. And we can secure the fabric in a couple of ways. With a small amount of skin-friendly tape in the 4 corners. So that might be like your paper tape, or tucked under your clothing as well. We can remove the fabric tape before bathing and reuse it, or remove the fabric, so the Interdry before bathing, and reuse it when it's finished for up to those 5 days. Again, when removing, gently separate the skin fold and just lift it away. So a few hints I found is that Interdry can be written on with a ballpoint pen. Might be helpful to label with the date it was placed on you. And then each piece of Interdry can be used up to the 5 days, again, depending on fabric soiling and odor, the amount of moisture, and your general skin condition. The Interdry will always be a little wet because it's absorbing and translocating that moisture, but it shouldn't be soiled with urine, blood, or stool. We don't use any creams, ointments, or powders with the Interdry, as it may interfere with the product's efficiency. And again, we don't recommend washing the Interdry because you remove the silver, and the silver is your antimicrobial properties of this fabric. Any questions on use and how to measure?
One question that I have, Pat, is the is the Interdry meant to be on or in place 24 hours a day while you're
Yep.
awake, while you're sleeping,
Yes.
except for when you're showering, of course?
Yes. Yeah.
So it is meant to be there all the
Yeah.
time.
Yeah, I do. I keep it on my people all the time. And so the only time I take it out is I will remove it, let them shower, wash underneath, and then I can put the same piece of fabric back in for that total of 5 days. And that's actually what reduces your cost. So you're not putting in a new fabric every time you wash their skin folds.
I have some other questions about the Intertrigo or Intertrigo, is I think is how it's pronounced.
kind of
So maybe we'll
forgot
come
to-
back. We'll come back to that afterwards, I think.
Okay, sure. Okay. So this slide here shows how it's really easy to use even in some of those challenging locations. So often times we'll find intertrigo between the toes. The toes are really a breeding ground for fungus and bacteria because it's moist and it's dark. So you can clean and dry well, and then you can run a strip of the Interdry and weave it through the toes. What will happen is the Interdry will again absorb that excess moisture that's there, translocate or remove that moisture from the area, and deliver the silver so that you can get your antibacterial and antifungal properties. And as you can see by the slide on the right, it resolved the intertrigo between the skin toes in 3 days. The bottom picture there was intertrigo under the armpit. Again, they washed it, dried it well, applied the Interdry, and the intertrigo was resolved in 7 days.
One more quick question there, Pat. For the Interdry, would that be for athlete's foot as well, or is that a different?
No,
thing?
I use it for both, and I use it lots for, your diabetic feet and your diabetic toes, how it gets really moist and they get that athlete's feet that's in there, and that cracked skin, and that moisture is just a wonderful breeding ground for further infections. When I did my Nurse Continence my Enterostomal Therapy Program, I spent some time in the IV therapy, and probably 80% of the people getting antibiotics for cellulitis, so skin infections of the lower legs, were diabetics with athlete's feet. Athlete's feet is just a perfect portal for bacteria.
And if I can just interject this other question, because we mentioned earlier on, or you mentioned earlier on, about type 2 diabetics.
Yeah.
Is this the intertrigo? Is that more common with people or worse for people with diabetes or type 2 diabetes?
Yeah, it is. There's several reasons for that. First of all, people with diabetes have a different pH in their skin folds, which leads them to be susceptible to these types of infections. Also, with diabetes, we know that they have an altered autoimmune system, which also makes them more susceptible to developing secondary infections as well, and their healing time is much slower. So yeah, diabetes is certainly it's sort of, not that it predisposes you, but you just have to be a lot more careful just because of the effects of diabetes on the skin and the entire body.
So as you mentioned before, with diabetes and then athlete's foot, cracks in the skin, getting cellulitis in the legs, then I would imagine with the bacteria that's here in the intertrigo, it's quite possible that someone might get cellulitis from the area of the intertrigo as well then.
You could, certainly. And, especially when they get those, when it breaks down and they get those open sores in that area as well. And that's why you want to try to get the Interdry in when you see the areas are just becoming red and inflamed before it actually gets broken down.
Excellent, thank you.
Yeah. Alrighty, so I think, you know what, I might be missing a couple of slides here. Sorry. Yeah, I am. So I just wanted to also say that intertrigo or not, well, intertrigo can occur, but we can in many different areas of skin folds and under devices. Some of the areas that we don't really usually think about and that we need to do some in that, like we need to really do a good skin assessment, are perhaps in the skin folds behind in the neck and behind at the base of the skull. Certainly we know about under the breasts, the armpits, your abdominal skin folds and your groin as well. And now we know about between the toes. Some of the other areas that can be affected under the devices may be under cannulas, so your tracheostomy cannulas, cervical collars, under your splints, or air casts as well, your pressure gradient footwear as well. You'll find that you might get that intertrigo, or I use it a lot with my braces and my splints for people that are either that have contractures as well, because you get that foul odor and a lot of moisture because of the lack of airflow there, and it works really well to manage the odor and the moisture that develops underneath there. If we're doing it for braces, we just have to make sure that we'll use that 2-inch tail for the wicking, and again, that silver will manage the odor as well as the moisture that's found underneath there. And another use of the Interdry that's kind of new is around those people that have ostomy appliances as well. A lot of the complaints I get is that the appliance is causes the skin, you get a lot of moisture buildup from sweat because the back of the flange might be plastic or it gets hot. So you can actually take and remove the flange part or the pouch part, cut a piece of Interdry and just put it around there and then attach your pouch to your flange as well. And it'll manage any moisture that builds up there in that area. And sorry, Jessica, I don't know what happened. I lost those slides with pictures.
That's no problem. I can bring them up after.
Okay,
yeah.
sure. So we can recap on just what we've discussed as well. So the definition of intertrigo is that it's a type of moisture associated skin damage that's caused by moisture, friction, bacteria, and fungus. And remember, it's not just fungus, it's bacteria. The 4 causes again is moisture, friction, bacteria, and fungus. And then the 4 key benefits that only Interdry can provide is that it manages all of those 4 causes all at the same time. So it will wick away them, it will absorb and wick away the moisture, manages the friction that occurs between the skin folds. It manages both bacteria and fungus because of the silver within that product. And so Jessica can talk about Interdry, how it's supplied and how you can obtain it for yourself. Thank you.
That's great. Thank you so much, Pat.
You're welcome.
That was great. I can bring up a couple of the photos that Pat was talking about if you guys would like to see, and she can maybe speak to those a little bit. They're just more application, just so you can get an opportunity to see them. Let me just.
Yeah,
And I have.
It's kind of hard to see, to visualize when you can't, you're not familiar either.
Yeah.
And I have some other questions about just the condition of intertrigo and those kinds of things as well. So
sure.
I don't know if now would be a good time to ask those, Jessica, or would you like to?
Let me see if I can bring this image up for you. And then maybe we can speak to them at the same time. Are you able to see this?
Yes.
Yes, okay.
Oh, good.
Okay, perfect. So I think this is just so everyone can have a little visual of some of the areas that Pat is mentioning. So kind of she discussed kind of under different skin folds, not just kind of the ones that we think of off the top of our heads. And then do your questions kind of fall within application, Scott?
Not directly.
Not directly.
I mean, the pictures that you're showing sort of speak to the way the issue was raised last year with the heat dome, especially for those of us who use wheelchairs all the time. We're sitting all the time, and the heat is getting trapped in the groin area and things like that. And people were
don't have the airflow.
Right, exactly. And they were talking about the heat rash that they were experiencing. And full disclosure, I was talking about it myself, this heat rash that developed, and it developed severely during the heat dome time. Now, is that what people would commonly cause, or pardon me, commonly call intertrigo, would be this heat rash? And does it have other common names? I could name a few, but I don't want to be crass.
So I would say that your heat rash is a symptom of the heat and the moisture that could lead to the development of intertrigo. So when you see that heat rash starting, then it's time to consider using the Interdry to help manage that moisture for you. Because it's the heat and the moisture and the lack of airflow that's causing that rash. That rash is just saying to you, hey, my skin is bothered and I need to get it looked after.
I hear it commonly referred to by able-bodied athletes and stuff as jock itch or crotch rot or something like that. Okay, I'll be crass.
And you're right.
But,
and that's intertrigo. That's often because you get those secondary infections. And so once you start getting the bacteria and the broken down skin and the fungus that's there, that's where you get your itch and your redness and your inflamed skin.
and is that what you would have, or that it was being complicated by other things like, say, a yeast or a bacterial infection, because a lot of times it's accompanied by odor or things like that?
Yeah. And so what happens is we go to the doctor because we have this red rash and it's itchy and it smells. And so first thing that they do is they treat it with that antifungal powder. And the concern with that one is that they're not treating the bacteria. So often the fungus will be treated, but that infection may not go away because the bacteria has not been treated.
So,
and you haven't treated the cause of the problem. The cause of the problem is moisture. And so with any of my wounds, I always teach that you have to treat the cause. And so if the cause is moisture, you need to treat the moisture.
Right. And the moisture then contributes to the other things like the yeast and the bacteria.
Absolutely, because bacteria and yeast love warm, moist environments.
Now, this point comes back to the application of it too, because you would go and see a doctor and the doctor would say, oh, well, we have to prescribe because it's a contact dermatitis of some type. So we're going to prescribe a clotrimederm cream or something like that. So you lather the cream on in the areas there, and then you put the Interdry on when you've got the cream in there?
No, Interdry, you don't want to put any powders, lotions, creams, or anything there. You want Interdry to touch the skin folds, and that's so that you can get the proper absorption and movement of the moisture out of the area and the effects of the silver to kill the bacteria and fungus. If you put things between the skin fold and the Interdry, you're not going to get the effect of Interdry. All you're going to do is get another piece of cloth in there.
There you go. Okay, well, thank you. That was supposed to be a skillful segue back to Jessica to talk about application.
Alrighty.
That's great. Thanks, Scott.
I hope I addressed it. Anything else, Jessica, that you would say to add to that?
No, I think that's just really, really great, really concise, Pat. I think it's exactly what we want to focus on, right? Is just application. This couple slides are just so you can see a little bit of application. And I think I'll let Pat speak to it a bit more here, but just really looking at how there's different ways to apply it and just really ensuring that that 2-inch tail is present.
Yeah. So if you look at the top picture, this is a lady that had intertrigo in her skin folds in her breasts. Those brown spots that are there are just seborrhea keratosis, and they really have no they don't influence that at all. That's just another skin lesion that she has. However, if you look at her breast area, you can see where she's got that darkened area that looks really bruised. I would say that that's definitely where there's a lot of skin damage. You can see the redness in the skin folds that are there. That's the intertrigo that you see. You can see a little bit of the white line right at the very skin fold area. That's what we call maceration. So, you know, when you've been in the bathtub for too long and your skin turns white and wrinkled, that's the same effect of what's happened there. That's too much moisture. So they applied, at the bottom picture, you can see how they applied the Interdry. So you can see where they measured from breast to breast. So probably if she's got it under one breast, chances are she's got it under the other one. So I would measure the entire area from breast to breast, and then one extra grid on either side to allow for that translocation, the movement of the moisture out so it can be evaporated. The Interdry, they've obviously cut in half so that you don't, because you don't need a full foot. Hopefully my breasts and skin folds aren't going to be a foot long. I only need half of that. So I've already got measurements and an extra piece of fabric if needed. And the middle picture is where you can see the difference in how that skin fold has improved after the 5 days of application there.
Perfect. Thanks, Pat.
Yeah. This next slide is some intertrigo underneath the armpit. This is actually a fellow that had cerebral palsy, or a woman with cerebral palsy. So we know that especially those people or anywhere where you're not going to get a lot of airflow. So if you've got, you know, you're using maybe a walker, a brace, a splint, a wheelchair, you're going to get that rubbing and that moisture in that, especially in that armpit area. So what this person did to apply it is that she used and cut the Interdry, and then she made a cutout area for her entire arm. So she could, and then she probably would tuck it underneath her clothes or whatever, so that it would help hold it in place. But it was just really a nice comfortable way to apply the Interdry where you didn't need tapes or anything, and it's not going to move. It's going to actually stay in place.
Yeah.
And then again, this is where I talked about the different applications under devices. So your trach tubes, I use it under my G tubes as well if needed. You can see where they've used it under cervical collars, blood pressure cuffs. So when I'm teaching to people in the hospital, let's say somebody's on constant monitoring, like in an ICU, I like to recommend to use a little Interdry underneath their blood pressure cuff, just to manage the moisture and the friction and the irritations underneath the cuff that develops. You can see with E, that is a soft splint, and then G is the pressure relieving device that we use for management of maybe heel pressures while a person's in bed. And then, of course, there's your air casts or your other splints as well. Again, just remember that if you're going to use the Interdry, make sure that you have that 2-inch area for wicking. I have people that have used it under their air casts. So they'll just run a strip from the bottom of the foot all the way up the cast, and then leave a 2-inch wicking tail at the top of the cast for that movement. Can you get it under compression socks? That's really a good question. You could use it under compression socks as well. And then make sure that you have your tail for wicking. The only concern I have, you have to make sure that if you're going to do that, that you don't allow for wrinkles underneath there, so that because the pressure of the stocking and a wrinkle of the fabric can cause some pressure areas and further skin irritation. It's a good question. I know they're hot and nasty. And then again, this is the application for those people that have an ostomy, where what I would do is, and you can see where the person has done it, where they've actually cut the diameter of the opening in the phalange. So they've taken the pouch off, applied the Interdry, and then reattached the flange back on. So that they won't have that moisture and irritation built up. And sometimes too, the complaint with those pouches is that it really rubs against the skin and can cause some irritation.
That's perfect. Thank you, Pat.
You're welcome.
All right.
Anyway, we are at the end of our time, and I just wanted to say quickly thank you to those that are here today with us, and for those that are watching this online afterwards. Thank you for being here. Thank you for checking it out. Pat, thank you for a great presentation. That was excellent. Jessica, thank you for our talks in the past and for setting this up for us. This is great. I should say that we can let the people that are here today go, but if you can stay, Jessica, Pat, stay online so we can say our proper goodbyes. And thanks everybody for being here.
Yeah, thank you.
Yeah, thank you.